We are in a unique period of change in our healthcare system. Among the many opportunities for improving the care of patients with mental illness and substance abuse is to focus on both general medical and psychiatric disorders. Often referred to as integrated care, it can occur in primary care offices, in community general hospitals, and as it has for years, on consultation services in general hospitals. We know that there are higher rates of mental illness in patients with other chronic illnesses, and higher rates of chronic medical illness among patients who have psychiatric disorders. Patients with these conditions are more likely to be in worse health and to die years too soon. But because of the way our healthcare system has evolved over time, there's been a tendency to treat these illnesses separately, as if they occur to different people. Effective integration of medical and psychiatric care could potentially also save a great deal each year in healthcare costs, according to a recent APA study. What was clear in this study is that patients with mental health and substance use disorders are far more expensive to care for, and that the increased cost was not due to their mental health care, but to their increased use of hospitals and emergency rooms for general medical problems. So-called managed care solutions, which ratchet down access to psychiatrists, will never solve these issues. Untreated or poorly treated mental health and substance use disorders in the primary care setting often mean once treatment is started, the patient's illness doesn't respond to it. Their illness persists, higher complication rates result, the patient suffers greater disability or needs more health care services. Their health care costs are higher, and in some cases, the result may be premature death. Likewise, there's clear evidence that a failure to provide general medical care in community mental health centers contributes to the worsening burden of disease. The APA has been actively working on this issue for a number of years. A Board of Trustees work group on healthcare reform recently recommended that psychiatrists and primary care physicians must play a major role in formulating integrated care solutions. We need to define clinicians' roles and benefits to patients and to maintain an ongoing inventory of current models. This will help us identify those that incorporate best practices for physicians, healthcare leaders, and policymakers, and improve them if we discover opportunities to do so. Mental illness is important because of the human suffering that so many patients and families experience. It's also important because of the toll the current system is taking on healthcare systems and general medical care costs. We need to acknowledge these facts and use them to chart our future. Psychiatry plays a central role in this effort, and the burden of our illnesses is simply too large to ignore. But it is true collaboration and physician-led care across all of medicine which will result in the improved care, improved outcomes, and the cost savings that we seek. Thank you for watching.